Hello, Sean Atwood here, London-based author and activist. Getting lots of questions and comments coming in on the channel about the coronavirus. When I was in prison, I managed to read over 1,000 books in just under 6 years. I read books like Guns, Germs and Steel. I read books about all of the disasters that had struck the world. Plagues, Black Death, flus, and became aware that periodically the germs do outsmart us. Germs have been around for, what, billions of years? How long have we been around for? So they have shown to be more durable than cockroaches, and periodically they will outsmart our immune system. And then generally what happens is the immune system fights back, figures out a way in the war against germs and bacteria to prevail, and the human race continues to exist. So there have been absolutely catastrophic, in terms of percent of the world's population that was wiped out during these battles. Whether coronavirus is just going to jump up like another SARS and die back down, like Ebola and die back down, is anybody's guess. But I do believe eventually, in this war against germs and bacteria, something will manifest that causes a large fatality rate worldwide, because it's just something that has happened historically, and I don't think there's any way to prevent it, no matter how many vaccines are produced. I'm going to get to that component of the story shortly. So, the latest news with the coronavirus, it was like 250 people died in a single day in China. The cases are now over 60,000. And it was the biggest rise ever, as it's heading up right now. The Hubei province saw 242 deaths. And the Chinese, it seems, are not letting us know exactly the extent of the infection. The Hubei Health Commission has changed the way now they record the virus, and have accounted for 15,000 more cases, which is what shot up the numbers in a single day. Joe Rogan was showing videos of streets in China getting sprayed with chemicals, and drones dropping chemicals, speculating as to whether these videos were real or not, in China. But you know, if it is the big one, it's only just getting started. But generally the probabilities are these things, we get them under control, like we saw with SARS and Ebola. So now we've got the new figures accounting for more than half of the total fatalities. Twice the prior provincial daily record of 103 deaths. The state media in China is saying that Hubei will start recognizing computerized tomography CT scan results as confirmation of infections, which will allow hospitals to isolate patients more quickly. There were some reports here that people in prison in the UK had it, they were getting quarantined. But imagine being in prison and it starts to spread, and then you're in this environment where you can't even get away from it. So prisoners are very susceptible to these kind of things, and they're often used as guinea pigs by pharmaceutical companies. Like I wrote about the Arkansas State blood scam on the prisoners, where Arkansas, when Bill Clinton was governor, this is in my book, Clinton, Bush and CIA conspiracies, about how they were selling the contaminated blood worldwide that had hepatitis and AIDS. And people died all over the world. I think people are still suffering the consequences of that. But often vaccines, they'll experiment on the prison population with vaccines because they're not considered public citizens. It's considered like institutional use. They're prisoners of wards of the state, so they can get away with far more things. So, back to Corona. So, Reuters reported that a lack of RNA test kits in Hubei's capital, Wuhan, may have delayed patients from being properly diagnosed and treated, contributing to the spread of the virus in its early days. The World Health Organization has said the number of cases of infection has stabilized. They had said that, but added that the apparent slowdown in the epidemic should be viewed with extreme caution. This was before the recalculation of the numbers. The outbreak could still go in any direction, said the WHO's Director General in Geneva. There was a 2-day meeting on science and innovation into measures to tackle the virus, and the director welcomed the positive responses of the research community to come up with concrete plans and commitment to work together. The WHO-led advanced team that travelled to China earlier this week had made good progress on the composition and scope of its work. So China reported on Wednesday low numbers, but then the recalibration caused them to jump. The head of the WHO's emergency program, Mike Ryan, said the stabilisation was reassuring, as was the apparently less aggressive and less accelerated behaviour of the virus outside of Hubei province. And this is thanks to a great extent due to a huge public health operation in China that gives us the opportunity for containment. But it's still too early to predict the beginning, middle and end of the epidemic. There are various predictions of the epidemic's curve, and they're triggering waves of panic worldwide. Professor Gabriel Lung, Chair of Public Health Medicine in Hong Kong, said that because the spread potential of the coronavirus is from one infected person to another, 2.5 on average, up to 60% of the world could become infected. With the worrying estimate that even if the death rate remained as low as 1%, it could still claim the lives of 45 million people globally. But it's too soon to say that tide has turned in China, but the stabilising cases are offering hope. He said his team would need to establish whether containment methods being used are effective at stopping the spread of the virus. And the intensity of the outbreak is based on a measure used by epidemiologists called RO, pronounced R0. Estimates how many people each infected person infects in turn. So for corona, it's around 2.5 people versus measles, which has 15. But the actual spread, as opposed to the maximum, fluctuates as more data becomes available and containment methods evolve. E.g., if a wave of new cases came today, the people who might have been infected for some time but were asymptomatic, the spread estimate would increase. If tomorrow a higher percentage of those identified as potentially infected were isolated more quickly, it would lower the experts' estimates of the spread. Predicting the curve can of course help with health planning and give a rough estimate, but these are notoriously inaccurate estimates. Governments worldwide are trying to contain the virus. If it fails, this response will switch to mitigation, and China has locked down whole cities, including Wuhan, at the epicenter. Some have criticised its measures as draconian and expressed suspicions that the country hasn't been fully forthcoming about its cases. But the WHO on Wednesday praised China's actions for making us all safer. Now, there was news on the BBC here in the UK about vaccines. The global vaccine market is expected to expand to $60 billion this year. That's £46 billion. I've said over and over in videos, I'm fully aware of vaccine science and how that has helped humanity. My gripe is over-vaccination. When the profit motive takes over in these industries, you get an evil, psychopathic excess. You went from prisons housing people who harm other people, murderers, robbers, rapists, drug traffickers, to prisons housing low-level drug users, people with weed possession, people with low-level drug possession, people who are holding drugs for themselves. At the worst, they're harming themselves, they're not harming other people, which has caused the mass incarceration that there's a backlash against in America. Vaccines, people, if you're talking about over-vaccination, people label you as anti-vax. That is not the case. What we've got, just like with the prison industries, is the corporations giving the politicians tens of millions in political contributions, just like the bosses of the private prisons have done, to expand it so that people are getting vaccinated left and right, and countries are mandating it. You will lose benefits in Australia, etc. And I've done work on this with David Icke. So if you want to see that video with David Icke, I'll put it in the description box. Also, David Icke has done a video on the coronavirus, linking it to Bill Gates, the World Health Organization, and vaccines. And it's about, I think it's about 20 minutes long. I'll put that in the description box as well. It's really good, detailed information by Icke, as usual. So, who dominates the global industry? Vaccines, it's Pfizer, Merck, GlaxoSmithKline, Sanofi, Johnson & Johnson. Vaccine sales have doubled since 2014 because of all of the vaccines that are getting pushed on the public. And governments are the biggest clients. I said to my parents, the flu vaccine, it's a huge scam, all these profits that we're making. And they say, well, the government gives us the vaccine for free. How can they be making profits? The taxpayers are paying billions for these vaccines. These are the biggest contracts in the world. So driving the growth of vaccines has been the increase in diseases like the flu, swine flu, hepatitis and Ebola. Dr. Elin Hohen, Director of Medicine's Law and Policy at University Medical Center Groningen in Amsterdam, said, "One would think that the industry has the reserve to jump at this challenge, i.e. the corona, but none of the 4 top vaccine companies have shown significant interest." So there are a handful of smaller pharma companies pushing to find a vaccine for the deadly COVID-19 outbreak. Gilead is a US biotech company. I've traded their shares over the years. They've been around for a long time. They make anti-HIV drugs. Announced it will trial its drug remdesivir. Meanwhile, Kaletra, a combination of 2 anti-HIV drugs from pharma group AbbVie, is being trialed on patients in China. Both trials are based on existing medicines. Quote, a large company like Gilead or AbbVie will be able to use an existing medicine against this as a therapeutic treatment, but it's unlikely to be much of a needle mover from a stock market perspective for a large company like that. Even so, let me just pull up the stock price of AbbVie. Has popped in the last month from around 80 to almost 100, so 20-25% gain. On some of that stoked by the corona outbreak. Gilead has jumped up not so much, from 63, got as high as almost 70. Just looking at the stock market prices there. So, for COVID-19, charitable donations are being used to spark pharma companies to find a vaccine. And a leading player is the not-for-profit organisation, the Coalition for Epidemic Preparedness Innovations, which include the governments of Norway and India, the Bill and Melinda Gates Foundation, and the Wellcome Trust is supporting vaccine development programs by Inovio Pharmaceuticals and Moderna. And like I said, David Icke has weaved Bill Gates into this nicely. He's done extensive research on that. I'll put the link below this video. I urge you to listen to that if you want far more information. So GlaxoSmithKline has agreed to make its technology available to the CEPI to create a medicine against the corona. So vaccines often require lengthy testing periods and massive amounts of money to be invested. But when there's an outbreak like this, they tend to fast track. With SARS came and went so fast. There was no vaccine for SARS available. Ebola, Merck did the vaccine, which was deployed in Guinea, West Africa. It was an unlicensed drug, but it was rolled out fast for compassionate use after the Guinean government authorized it. Merck's vaccine was not given regulation approval in the US until last year. Johnson & Johnson also got an Ebola vaccine out in the Democratic Republic of Congo. Ronald Klein served as the US Ebola response coordinator. Quote, "I don't work for the companies, I'm not like a drug company fan. But there's no question that a lot of them lost a lot of money trying to produce an Ebola vaccine, and then it died down." So it's a bit of a sad thing that there is this profit incentive for these diseases to expand, to make these companies' investments worthwhile. Side effects are one of the things that are supposed to be being tested on the vaccines. And people who say vaccines are 100% safe, read the disclaimer that comes with the vaccine. Most of them say these vaccines can cause all kinds of harm, including brain damage and death. It's right there. The pharmaceutical companies admit it themselves. So I'm thinking about doing, because I read this stuff and I found it fascinating in prison, a video on the 7 deadliest diseases in history and where are they now. Let me know if you would be interested in that. I could talk more about the coronavirus, how it's contracted and spreads. And also, I'm interviewing Sonia Poulton in the next few days, part 3. I'm going to put a comment at the bottom, pinned below this YouTube video. If you have a question for Sonia, please put it in the responses to that comment. And I'll print all of those out and I will take them to the interview and we will ask Sonia your questions. So, cheers from London. I've got to go to a school talk now. South of central London. Huge thank you to all the subscribers. If you've not subscribed yet, it is free to subscribe. Please help us get over 400,000 subs. We're almost there. Subscription logo, bottom right hand corner of the video. Huge thank you to all the people who've donated on PayPal, Patreon, Just Giving, Subscribestar. Thank you for helping me keep these videos going in studios, getting great guests with professional camera crews. And thanks for sharing, liking, and writing comments and questions below. I love reading all of your feedback. Cheers. Take care. Thank you. Bye.